Welcome to our channel Hashmi Clinics.
All right, let's jump right into our deep dive on APOCYNUM CANNABINUM. We're going to unravel this incredibly powerful but, often misunderstood remedy. The goal here is to move beyond just the textbook stuff and really give you that clinical confidence you need right there at the bedside. Okay, so here's our game plan. We'll start with the absolute core of the remedy, then we'll build out the whole picture, from the mind to the organs, and finally, we'll get into the nitty-gritty of how to actually use it in practice. Let's get started. So what's the one thing you absolutely have to get about APOCYNUM? It all boils down to this: a systemic failure of elimination. Seriously, this is the core pathological theme that drives everything else we're going to talk about. This really is the foundational keynote. I want you to picture a body that's just completely waterlogged. The body's ability to get rid of fluids, especially through urine and sweat, is just profoundly shut down. You'll even hear patients say things like, "Doc, if I could just break a sweat, I know I'd feel better." Their system is taking in water, but it just can't release it. And that, of course, leads to all-over fluid retention. And right here, we hit the remedy's most famous paradox. The patient is intensely thirsty, like they're craving water, but their body just cannot tolerate it. We're talking even a small amount can cause pain or get thrown right back up. This internal conflict, this contradiction, it's a central theme you're going to see over and over with APOCYNUM. Okay, so we've got this waterlogged physical state. Now let's take a look at how that translates into the patient's mind and their overall physical picture. So the mental picture, it's pretty much a direct reflection of that physical toxicity. It's like the mind itself is just as waterlogged as the body. We see bewilderment, low spirits, real sluggishness. There's this profound apathy, a total loss of ambition. And you really need to pay attention to this keynote. The patient faints when they try to raise their head from the pillow. That points to a really deep level of vital depression. Now, on a general physical level, the patient is intensely chilly. They're just made worse by anything cold. And get this, despite all that fluid backed up inside, their skin is paradoxically dry, rough, and they just can't sweat. Then you've got that classic great thirst for cold water, which of course only makes them feel worse. Add to that a general loss of muscle power, relaxed sphincters, and this awful sinking feeling right in the pit of their stomach. All right, let's zoom in on the key organ systems now and see exactly how this functional paralysis and fluid imbalance actually plays out. So when we look at the heart, we see a pretty significant loss of power. The heart's action is depressed, and you'll often see things like mitral and tricuspid regurgitation. The pulse is a big one here. It's slow, it's feeble, it's irregular. The patient might complain about fluttering or darting pains around their heart, along with a heavy, oppressed feeling in the chest, and of course, a lot of trouble breathing. Now, that slow pulse, that diminished frequency, this is an absolutely prime, high-grade guiding symptom for APOCYNUM. It's a cardinal feature, especially when you're dealing with cardiac dropsy. So if there's one thing to remember here, it's that slow pulse. Moving to the GI tract, well, it's extremely irritable. You'll see nausea, often with a lot of drowsiness. The vomiting is just excessive. It's violent. Food, water, it all gets ejected immediately. The abdomen, often bloated, filled with fluid, ascites. And the bowels are in the state of paresis, which means you could see constipation or you could see this copious, watery, gushing diarrhea that's characteristically worse right after they eat. They might even describe a sensation that their sphincter feels weak or just open. When we look at the urinary system, it's just sluggish, torpid. The urine is scanty, maybe even suppressed or turbid, and there's very little power to expel it, which can lead to dribbling from those relaxed sphincters. Now, in the female sphere, we see these two extremes. You might have amenorrhea, so no periods in young girls who are also bloated. Or you could see the complete opposite, a profuse, exhausting uterine hemorrhage, metrorrhagia, with huge clots, fainting, and just a profound collapse of vitality. And in males, you can even see dropsy of the penis and scrotum. Okay, now for a very, very peculiar and characteristic keynote, especially in cases of hydrocephalus. The child is lying in a stupor. You might see open sutures, a projecting forehead. They might even lose sight in one eye. But here's the absolute kicker, the most striking feature: constant involuntary motion of one arm and one leg. Not both, just one of each. When you see that, that is a powerful confirmatory sign for APOCYNUM. So what actually triggers an apoptotic state? Understanding this is absolutely key for prescribing well. Let's look at some of the causes and patterns. You'll often find APOCYNUM is needed for these dropsical states that pop up after really debilitating acute illnesses, things like typhoid or scarlatina, or even after cirrhosis. We also see it after the abuse of quinine, in cases of acute alcoholism, or after a major uterine hemorrhage. Basically, it's for any situation that just leads to a total breakdown of the vital force and the body's ability to regulate fluids. And you've got to keep your eyes peeled for this very distinct clinical pattern, an alternation between dropsy and diarrhea. What you'll see is a period of swelling and fluid retention that is suddenly relieved when a massive, watery diarrhea starts. And then, just as suddenly, the pattern will reverse. When you see that back and forth, that's a huge indicator for APOCYNUM.
All right, let's really sharpen our prescribing focus now by digging into the modalities and comparing APOCYNUM to its closest relative.
The modalities here are just crystal clear and super consistent. The patient is profoundly aggravated by cold in all its forms. We're talking cold weather, cold drinks, even just uncovering. They're also worse after sleep and from lying down, and that diarrhea, as we said, is characteristically worse immediately after eating. The only thing that makes them feel a bit better? Warmth. So this brings us to probably the most crucial clinical question you'll face. How in the world do you differentiate APOCYNUM from Apis mellifica, right? They're both huge dropsical remedies. Both can have dropsy, scanty urine, dry skin. Well, the answer lies in two key generals that completely define the patient's state. And this is where you see they are absolute polar opposites. Your APOCYNUM patient is intensely chilly and worse from cold, but they have great thirst. Your Apis patient, on the other hand, is hot, worse from heat, and is characteristically thirstless. And yeah, both can have dry skin, but APOCYNUM is chilly and can't sweat, while Apis is hot and has those classic stinging pains. Look, if you remember nothing else from this whole session, remember this. APOCYNUM is the chilly Apis. That's it. That simple little mnemonic is an incredibly effective way to tell these two giants of dropsy apart in your practice. The chilliness and the thirst of APOCYNUM, those are your guiding stars. Okay, last section. Let's pull all of this together into some really practical, actionable prescribing tips. So here's your quick mental checklist. Number 1, is there dropsy? Edema, anasarca, ascites. Number 2, are the excretions diminished? Scanty urine, dry skin that can't sweat. Number 3, is there great thirst? Number 4, is there vomiting, where food and water get thrown up right away? And number 5, is the patient profoundly chilly and worse from cold? When you see those 5 things all coming together in one case, APOCYNUM has got to be right at the top of your list. You see, APOCYNUM really presents such a clear, consistent picture of a total breakdown in the body's fluid management system. Once you really master its unique state of functional paralysis, that hallmark paradox of thirst with an irritable stomach, and its key differentiator, the chilliness, you can confidently add this incredible tool to your clinical toolbox. So the question I'll leave you with is this. Is this the chilly Apis that you've been missing in your practice?
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.